osteoarthritis or osteochondritis dissecans, there's some abnormality with how the bone matures because of the forces. And sometimes that requires some work inside the joint. So an arthroscope is a much better way to do that than large incisions. Sometimes there's instability. The so-called Tommy John operation was a medial ligament reconstruction for a ligament structure that had been so weakened with repetitive pitching that Tommy John, a famous Major League Baseball player, was the first one to get this type of ligament reconstruction. Now, unfortunately, there are some much younger participants who are needing and getting these surgeries.
Now, you were saying that this could be avoidable? You mean that they would just not play so often?
Yeah, it has a lot to do with the schedule of how much throwing. For example, in the younger age groups, throwing curveballs is not allowed. And the reason for that is because there are even higher forces involved in the arm when trying to throw a curveball as opposed to a fastball.
Oh, because then they have to twist their wrist.
Exactly. And then the reason that there are these things with pitch count is trying to limit the number of episodes that a young participant will be throwing.
And then they would then have injury all the way up?
Well, just to reduce the chances of them having these types of problems. And I think that's a good idea, but it hasn't eliminated everybody from getting these problems.
Now, common also with upper extremity injuries are rotator cuff injuries for people.
Right, and that's up in the shoulder area. And again, how the shoulder is designed anatomically is that there's a bone, such as this. This is the humerus. And then there's a cuff of muscle called the rotator cuff that controls the position of this joint. Then on top of that is another bone. It's the clavicle and then the shoulder girdle. So it's a bone-muscle-bone sandwich, if you will. And if there are bone spurs that develop, then that crowds the space for the rotator cuff. And again, this is one where decompressing that used to be an open procedure, and now a standard way is to do that arthroscopically. So having better visual techniques and tools that work in the joint with arthroscopic techniques has really helped us take care of these types of common sports injuries, both for the elite participant, the pro athlete, and the recreational athlete, and even the young athlete.
Now, people who just broke their clavicle and they're riders, such as Lance Armstrong and people like that, that must be hard for them because they have to be bent over riding. And do you ever do repairs for bicyclists?
Well, that's a really good topic. We've just finished another Tour de France, so it's timely. And clavicle fractures used to be treated mostly non-operatively. Part of the reason was that we didn't have very good implants or bone plates or fixation devices for the clavicle, which is a skinny, curved bone with a lot of muscle forces attached. I mean, think about it. The whole arm is sort of attached to the body through this clavicle bone. But research has shown that the results generally are better if these are surgically repaired. And so more commonly, the displaced fractures, the fractures where there's been some shifting of the bone, is treated with an operation. And, you know, we perform those operations and they're successful. But
are they also micro-incisional?
Well, the tricky thing is that the quality of the skin over the clavicle is not good. There's not a lot of fat there, folks. Even if you're a little rotund and have a little body fat, there's not much fat over the clavicle. So getting that skin to heal without complications is the challenge. And the original plates were very big and bulky. Now they're more slim and contour and fit the shape of the bone better. And these are enjoying good results with not as much complications as before. So for the active patients, I'm generally looking at discussing a surgical repair. The other thing is that because a clavicle fracture generally displaces, in other words, it shifts, then the the shape of the bone changes, and the importance of that is that the nerves going into the arm go right behind the clavicle. So that an old clavicle fracture with displacement can be a cause of arm numbness and pain and vague complaints. So we're trying to avoid that by happening, by recommending the surgery in many cases.
Now, tell us, you've played a role in microvascular microincisional surgery. Tell us, how have you played that role in this type of upper extremity sports trauma surgery?
Well, once again, there are initially advanced techniques required. So I've been involved in the training of surgeons to use these arthroscopic and minimally invasive techniques, help to develop some of the instrumentation that's helpful. I'm presently working on some newer ways to do fracture fixation. So I continue to think about my patients on an individual basis, but also in terms of what's lacking in terms of the tools available to the surgeon to make the surgery work more efficiently or more safely or more quickly. So there's always room for that innovation, and I'm happy to still play a pretty significant role in that.
Now, you have some videos.
Yeah,
Tell us.
and on this first one, we're looking at a wrist, the inside of the wrist itself, and you'll see first a view of some normal appearing bones, and then over to the side, this is what we call the triangular fibrocartilage complex. This is that cartilage meniscus-like structure on the pinky side of the wrist, and there's a little difference in the coloration there, and that's actually a defect in the cartilage disc. There's a hole in it that's been worn away from overuse or age or both. And that edge is irregular, and now I'm in the process of shaving that and lowering the level of the ulna bone underneath it so that there isn't that pain with the wrist going into ulnar deviation, bending, striking the ball, doing activities. This next one shows an elbow condition. And this patient had an olecranon bursitis, another type
So right
of
over here.
tendonitis, right at the tip of the elbow. Actually, see right there, I've got the scope in the bursa, and then at one point right there, I'm kind of looking out through the little hole that's eroded in the skin. So I'm using the arthroscope to try to take bone spurs off the tip of the elbow as part of my operation. And I'm able to do this without making a big incision, but using the arthroscope. And again, it's a better view through the scope than if I had opened up the elbow joint completely and looked at it with the naked eye. And so this patient gets a debridement and then some muscle flap treatments to try to cover up this area.
So in the weekend athletes, who most of us are weekend athletes or recreational players who are intense, what are the most common risk complaints if you were coming into your office, if you were going to count from like 10 patients who walk in? Is it mostly sports related from the pinky side or the thumb side?
Well, I don't think there is a single most common one. Actually, there are structures on both sides that can get tendonitis problems and overuse. And I think the most common thing that I see is people changing the level and intensity of their activity. You know?
Oh,
And
suddenly.
yeah, so and look, when you're working and then suddenly it's the golfing trip and people want to, just get as many holes in of golf, or they're on an adult tennis camp and suddenly ramp up the activity. That's a little risky because the body is not used to that more increased level or increased intensity or much more repetitions of that activity. So,
Suddenly.
yeah, and that's a danger. I'm not saying that people shouldn't do it, but they should use some caution, and not everybody can go from the 80-hour-a-week desk job or more sedentary job to a week of very intense physical activity without training, without warming up, without getting these problems. Luckily, Many of them get better on their own, but not all. And for the ones that don't,